Good morning, Congressional Committee members. My name's Tisha and I'm a current registered nurse. I'll be discussing with you all today on the topic of decreasing unsafe drug use among elderly medical beneficiaries. Did you know adults age 65 years and older are the leading consumers of medications and account for about 34% of pharmacy expenditures in the US? The issue of polypharmacy arises in particular within the geriatric population, as this group tends to have an increased level of chronic disease conditions. It has been estimated that about 20% of Medicare beneficiaries have 5 or more chronic conditions and 50% receive 5 or more medications. The use of a larger number of drug therapies have been associated with increased risks of adverse drug events, in part due to the potential for drug-to-drug interactions and for prescription of potentially inappropriate medication. Additionally, older adults are at a greater risk for such adverse drug events due to metabolic changes and decreased drug clearance. Older individuals receiving inappropriate medications are more likely to report poor health status at follow-up, and between 30 to 80% of adverse drug events in the elderly are preventable. I would like to delve a little deeper into the concerns for the prescriptions of potentially unsafe medications among elderly Medicare beneficiaries. According to this 2011 National Scorecard, the U.S. healthcare system is scored and assessed on 5 different metrics with a total of 42 indicators. These are the 5 here: healthy lives, quality, access, efficiency, and equity. So within the quality metric lies the subcategory titled Safe Care, which is here, and includes a total of 5 scorecard indicators. The scorecard indicator that I'd like to focus on is unsafe drug use, and more specifically, the use of high-risk medications among elderly Medicare beneficiaries and potentially harmful drug disease interactions among elderly Medicare beneficiaries. So when we look at this first graph on the left, this shows that in 2007, 25% or 1 in 4 elderly Medicare beneficiaries received at least one drug from a list of 13 classes of high-risk prescriptions that should be avoided by the elderly. I was able to pull up, this is the list of the 13 classes of high-risk prescriptions. So in addition, the rate of potentially inappropriate prescribing varied from a low of 18% to a high of 36% on that left graph across hospital referral regions. So when we look at the next graph on the right, the focus is on medical beneficiaries here who have one of 3 conditions. Either this person has dementia, has had a hip pelvic fracture, or has chronic renal failure. And here they have received a prescription in an ambulatory care setting that is contraindicated for that condition. 1 in 5 elderly adults, or 20%, received a drug that could produce a harmful interaction, as you see here in the median column. And then 1 in 5 elderly adults, or 20%, received a drug that could produce a harmful interaction. The rates of contraindicated drug use range from a low of 15% to a high of 26% across geographic regions. This shows that there is still so much improvement that needs to be done to lower and prevent the prescribing of high-risk prescription drugs. Something to note is that this indicator is new to the 2011 National Scorecard. Therefore, it's not conclusive as to whether this issue has shown improvement or significant deterioration. Nonetheless, the indicator raises concerns and definitely shows that there is still improvement to be made. So if we go back to the PowerPoint here. So ways which have helped to lower and prevent the prescription of high-risk drugs for elderly patients is actually through the establishment of the Beers criteria for potentially inappropriate medication use in older adults. So these lists of recommendations were published by the American Geriatric Society, and it plays a vital role in helping health professionals, older adults, and caregivers work together to ensure medications are appropriate. So some of the goals that the Beers criteria has set forth, and which was originally developed in 1991, are to improve medication selection, educate physicians and patients, and avoid adverse effects. This will help evaluate care quality and medication use trends for older adults. However, as from the 2011 National Scorecard, there's still work to be done to reduce and prevent unsafe drug use among the geriatric population. So what has not worked? The continued inconsistencies of electronic medical record systems among different care systems, such as within the hospital setting, or ambulatory care settings, or long-term care facilities, etc., may lead to gaps in a comprehensive medical history medication review that is most up-to-date with patients' medical records. This could lead to the accidental ordering of prescriptions that may be contraindicated given the patient's medical history or most recent diagnostic results. Additionally, some electronic health record systems may not have the function to prompt providers to review their orders, especially if a particular medication listed as potentially inappropriate or is ordered prior to sending prescriptions to pharmacies. Some quality measures and indicators. So quality is measured here by the absence of utilizing potentially inappropriate medications for elderly Medicare beneficiaries. And the quality indicators are drug-specific indicators and diagnosis-specific indicators. So the drug-specific indicator is receiving at least one drug from a list of 13 classes of high-risk prescription drugs. And for the diagnosis-specific indicators, it's having one of 3 conditions: dementia, hip, pelvic fracture, or chronic renal failure. And so therefore, there are certain prescription drugs that are contraindicated in these conditions. So what are the next steps? So health policies that surround the development of a new, revised, and universal health information technology system across the continuum of care at the local as well as national level would support the reduction of inappropriate prescribing. I am requesting to allocate a 35% increase in total funding towards the health information technology sector to develop a universal electronic health record system that can easily share and locate patient information across multiple levels of care. Such a system would alert providers about potentially harmful medications or possibly dangerous interactions with other drugs or certain diseases. This universal electronic health record system could also be integrated into pharmacies, as pharmacists could be another designated safety checkpoint prior to dispensing potentially inappropriate medications to maximize patient safety. When we're looking back at the 2011 National Scorecard, further research analysis on understanding the differences between the varied rates of potentially inappropriate prescribing from places that scored 18% to those as high as 36% could help identify other key factors in preventing unsafe drug prescription. So together, we can reduce patient risk from unsafe medication use and instead improve patient care and safety. Thank you so much.